You're doing so good, buddy.
Pain is much more complicated than people give it credit for. I think you either have pain or you don't.
You're doing so good. You're doing so
Interfering with the child's receptors for pain, interacting with the way that the nerves are conducting pain to and from the brain. It's not that we are simply distracting you from the pain. With virtual reality, you truly aren't experiencing it.
When I grow up, I want to be police officer, king, and doctor. Doctors save people, police protect people, king gets to boss everyone around.
It's kind of like you're dancing with a partner who doesn't speak your language. It really helps take away a lot of stress, and it's a lot of fun.
It's just what I do, me and my friends do. We play sports together. You're just pumped that you're contributing to the team.
I'm a bunny, evil-looking bunny.
I take care of Tyreek, and I'm his grandma. He's been sick since he was born at 30 weeks. For Tyreek, the biggest medical issues will be his short bowel syndrome. That's where he has to be fed through the Broviac line in his chest. He's been getting sicker, and that's developed into him having to have chemo, steroids, and various immunosuppressant drugs. He's also on the autism spectrum.
Once I came in almost 2 months and stayed in for 7 weeks. And it was not fun. Their food got bland. Isolation sucks, though. Isolation stinks.
When I was really little, they diagnosed me with an autoimmune digestive disease. So my white blood cells, they see certain foods as parasites and attack my esophagus.
Austin was telling me that his toe was bothering him. It was really red and swollen. And then he got a fever. And that's when I was like, oh, I think there might be some sort of infection. They started him on antibiotics. And then again, he spiked a fever. And that's when they decided they needed to do surgery.
The first dressing change was extremely painful. Probably the worst pain I felt in my entire life. I couldn't take it.
It was horrific to have to watch. Oh. So then when they were going to do the next bandage change, I just demanded that they had stronger pain medicine for him, and if they could do anything to help distract him. That's when one of the nurses said that they would call Child Life.
Are you okay?
A child's job is to learn, to grow, to socialize. It's how they develop. And hospitalization interferes with all of those things. As the medical director of Child Life, I'm the physician who's advocating for and working with child life specialists to improve the quality of the child's experience of being hospitalized.
Next dressing change on Monday, they gave me the VR, and I was playing a fishing game. You could look around, and it was so real that I didn't worry about my foot or what was going on. It did hurt, but it wasn't nearly as bad because I just kept fishing.
Really, the question is, how does virtual reality work to reduce pain? The human brain has a limited bandwidth for what it can pay attention to. The more I can engage you in that virtual experience, the less your brain is able to perceive the pain signals that are coming through. And if it's not paying attention to them, they might as well not exist.
Before they come in, about 30 minutes, I start crying because I know it's gonna hurt. And when they come in, I hide behind a corner of a wall.
Bandage changes, we do them every week at home, and they're rough. It takes a couple of our workers and a home nurse and me, and we have to hold them. And we tickle. We find ticklish spots because that's distracting. He can't focus, and that's where the gaming is, we're trying to bring it in, even at home.
Rachel gave me the goggles, and I put them on, picked the game, and started playing it. It keeps my mind distracted from pokes and pain.
We're seeing people who used to be under general anesthesia to tolerate certain procedures, able to be fully awake with minimal medications.
In the first year of her diagnosis, I think she had 4 endoscopies under general anesthesia. It's just terrifying to see your child go where you have no control over what happens.
A little tube goes into your mouth, down your esophagus. I remember my mom was crying a little bit, and I was scared because if she was crying, then there was definitely wasn't good.
There are risks that come along with general anesthesia.
All right, Miss Kyla, we're gonna get started.
All right.
Do you feel pretty numb? Go ahead and swallow for me. Does that feel funny?
Yes.
All right.
In Kyla's case, she's using virtual reality in place of general anesthesia to successfully tolerate her endoscopies. The impact of the child's life in that situation is profound.
Good job.
Want to take your hat off? I've worked with Tyreek for many months now. Every time he's here, he gets a barrage of treatments, a lot of illness and pain. So I worked with Ty to help him manage his pain in conjunction with recreational play for his lengthy stays at the hospital.
He's always goofy, acting.
Now I'm a pig.
He likes to hide his feelings behind that, and so he's always being funny and trying to make other people laugh, then they don't focus on him.
My favorite thing to do when I come to the hospital is using VR goggles and playing video games.
It's like magic.
Okay. Hi, lady.
VR is a great tool for hospitals in many ways. Distraction, pain management, procedural support. It kind of tricks your brain into thinking you're in a whole new place. And for kids who are stuck in a hospital room, what is better than going to a different place?
We could put people back in connection with some of the normal parts of their life. Potentially, we might be able to get the technology to the point that we could put them in their own classroom in real time with their teachers and their classmates. We could put you at the dinner table so that you can still share those experiences with your family. No longer are you disconnected.
I want to be a neurosurgeon when I grow up.
I want to be a horse trainer sometimes, but I mainly want to be a pediatric oncologist. I just really want to help more kids get better and live a full life.
Man, how dare you?
Man.
Steal Abe's job. That's what I'm gonna do. He's a video game person, and he's fun, he's kind. When he turns 45, his career's over. He's gonna be retired after he teaches me. He needs to teach me, then he's gonna retire. Then I'm taking his job. I'm kicking him out.